As you can see here, we've got a really busy agenda. The purpose of this session really is to launch our newest resource and to talk about some of the work of the Health and Wellbeing Alliance and the Carers Partnership. As you can see here, we'll be hearing from a number of different perspectives, including from Philippa as a carer and as Vice President of Carers UK, also from services and from within NHS England, and to be able to reflect on some of the changes that we've seen in legislation in recent years and why that's so important that we apply it in our day-to-day practice. Our hope for the session is that it will help you to connect different parts of the system and to make sure that we're all working in an integrated way to better identify and support carers as we know they so badly need. We're aware of the different pressures that carers are under, the real sort of push and the focus of policy to try and make sure that more care is being provided in the community where carers clearly operate a lot of the time. And so being able to understand how best to look for different bits of information and different resources to support you and to work together is ever more critical. So just to quickly touch on the Health and Wellbeing Alliance as an entity, for those that aren't familiar, it's in essence a partnership between different voluntary sector representatives and the health and care system itself. So the Department of Health and Social Care, the UK HSA and NHS England all make up those joint partners. And then ourselves at Carers Trust and Carers UK work with a number of different voluntary sector members to try and make sure that carers are high on the agenda on different areas of policy, that we're able to try and support people that might have different protected characteristics or that might experience different health inequalities. Between us, we then target different projects and bits of work to try and better support people and better support communities, and to try and make sure that the knowledge of different barriers is accessible to professionals working right across health and care. So this afternoon, we're hoping to be able to demonstrate a bit of what we've been up to in the last few years, quite a few different bits of work, which hopefully come together to really give you guys the best opportunity possible to link together, to work and understand the different needs of carers, and for us as well to be able to project the work that you do back up to different parts of the system. So thank you very much for your time this afternoon. I'm going to now pass over to Dame Philippa, who's going to talk a little bit about her experience as a carer.
Well, thank you for the invitation to join you. And I'll start by saying that I'm an unpaid carer. I'll start also by saying I absolutely hate the term unpaid carer, but nobody has ever come up with a term which would actually really represent our roles. I've been a long veteran carer for 60 years now. My husband had dementia, cancer, and heart failure, and caring for him was very challenging, very different to my severely disabled son, who a year ago was living in his own home in the community with support, a good package of support, fairly healthy. We were happy with everything. But then he ended up in hospital, a common story, a medical crisis. We were bed blockers for 10 weeks. And there've been one or two returns since. I hate the term bed blockers, but it recognises the challenge that some caring situations put us in. Now we are trying to find him a better life. I just counted before today that I and the local authority have been in touch with 37 potential providers who all turned him down, I might say. We have had the OT, we have had everybody you could think of to see if we could adapt the house, and which we're tackling the workforce. And I think that is what we're all living with. But I always have optimism. We have the Care Act, we have the Health and Care Act, and a lot of other legislation you hear more about. We have a legal framework, and I think we have a genuine commitment to recognising unpaid carers as part of the team. And the best advice I ever had was when my son was diagnosed, aged 6 months. I'd flown back from a Foreign Office posting in Central Africa, and his wonderful consultant said to me, however complex his needs, you are the key navigator in his life. You need to forge partnerships. You need to ensure that healthcare, education, housing can work together. And I think it's that spirit of partnership, of integrated working, however you describe it, of shared care, that really is what carers look for. Now, very quick couple of facts about the lives of carers, because our lives are tough. And we don't like complaining. We don't want to complain, but we are there to ensure that the people we care for have the best possible life. There are over 4 million of us in England. Some of us, about 1.4 million, like myself, have cared for over 50 hours a week. And when you're in your late 80s, that's quite a challenge. We did it because we wanted to, but it wasn't easy. A reminder that 1 in 3 of the NHS workforce have some caring responsibilities, and caring affects people of all ages. What do grandchildren and siblings do if there is somebody in the family with a disability? They're often hidden, but if we identify them, they can be part of the team appropriately. And I think we must remember that caring can be a social determinant of health. Our data shows that ONS data, 55% of carers in the survey reported adverse health impacts on them of caring. And 82% of Carers UK State of Caring respondents said that there were negative implications for their physical and mental health well-being. So we need to look after the carers, we need to identify them. And my quick messages, because I've got an eye on my Victorian clock and I have 5 minutes. We have huge opportunities with the government's ambitions for hospital not home, for digital transformation, and for prevention. Primary and secondary prevention, I would say, because if my son comes out of hospital again, he actually will have conditions which will have to be addressed through special services to keep him well. But if we can actually start by positively and proactively seeing carers as part of the team of care around the relative they're caring for, if we can ask carers if they are carers, but in a tactful way, please, because I've found it very uncomfortable to have a sort of question barked at me almost as a sort of requirement, but not one somebody wanted to actually meet. Are you a carer? I've been asked when I said I was a carer which care home I worked for because of my age. We need to ask sensitively, and we need to have information then and there. And a particular plea here to use the voluntary sector, because it has been the voluntary and community sector which have given me so much backup and information, have interpreted sometimes complex medical conditions, and have helped me navigate the statutory framework for assessment and shared decision making. Together we are powerful. I feel that I, as an unpaid carer, can look at Simon's care and the support that I need as looking at a completed jigsaw. You may feel that's an odd image, but so often carers tell me that they feel that their life is like a jigsaw which has been thrown in the air. Nobody's actually putting the pieces together. We actually, as carers, often have the best information, the best ability to make sense of our son, daughter, husband, wife's, friends situation, because we actually not only have lived experience of the care, but we are the living history. So please, can we have carer passports? Can we have information in multiple formats? Digital is wonderful, but a Bangladeshi carer said to me the other week, I love looking things on my phone, but I'd like something to put behind the clock on the mantelpiece to show my family. And also remember, you have to repeat information. It's tough realizing you're a carer and not a husband, wife, partner, or child. And my final comment would be, if we do actively identify, engage carers, then we have some wonderful strategic partners in what comes next. We're seeing reform of the NHS. We have a Commission on Social Care coming. We have a legislative framework already, and we have a large army, often silent, unfortunately, of carers like me, who are really keen to be part of that transformation process. Too often we're presented as an aging, sick society. I'd like to see us as Japan, where they see disabled and older people as having actually key additional experience and expertise in making the system well and making it affordable. Well, we're not Japan, we're England, and I think we can probably do even better. But just a final comment, please recognise that caring can be tough, that we want to care, but also we carers have some very, very good ideas about doing things differently and in a very cost-effective way. Thank you.
Perfect, then, Philippa. Thank you so much. And you can see that from the hand claps and the hearts there that it's really resonated with today. Well, having spoken about good ideas from carers, introducing Vicky, who herself is often one that we talk to, has great ideas. Vicky, welcome.
Thank you. So I'll crack on with my short presentation around supporting unpaid carers across obviously health and social care from a carer centre perspective. So next slide, please, if that's okay. So in the middle, and I think that's where carer centres are when we're looking at local authority and health, we are in the middle, and that can be a challenging place to be in, because you recognise that both social care and health have pressures and targets and measures, but they're all individual to themselves. And as the pressure mounts in health and in local authorities, people become very focused on their targets, and sitting in the middle between the two can be a challenge. We sit on, as I've put there, many improvement boards, and we understand that although at the strategic level there's a great commitment to unpaid carers and there's an acknowledgement of the legislation that's around carers, the actual day-to-day, putting it in practice in the day-to-day is the challenge. Next slide, please. Sorry, oh. Sorry, I froze there. So recognising the partnership and the value of that, these are just some of the areas that at Sefton Carer Centre we've worked on. So we've worked with Health Over Hospital Discharge project, which has wraparound support for the unpaid carer, and we work with another team in the voluntary sector who provide the wraparound care for the patient. So between ourselves and the hospital discharge team, we provide 6 weeks worth of support for the family as a whole. Obviously, where we do the carers assessments, we focus on impact from that hospital discharge. And our other voluntary sector partners, they support the patient, so they look after that side of it, and it's a really good, strong project. We also have worked on the virtual ward developments with our health and home first, and it's really difficult to think it's permanently grinding that message around, don't forget about the unpaid carer, look at the practices that you're producing, look at the document that you're producing. And I think one of the key things to look at, and we've been speaking to the hospitals in our area, is just look at their websites and see what it says about unpaid carers. It might have something about passports, but it doesn't have anything about legislation generally. It doesn't talk about sort of support and local support for unpaid carers. So the information is poor, but have a look at your local hospitals and just see what they say about unpaid carers. Is it good or isn't it good? One-off personal health budgets. For those that don't know, there's a national government funding where there's money. Some councils and health authorities use it differently. It's about £250. Some people put more into it. And it's all about providing a payment to support somebody to get out of hospital sooner, 2 days sooner. And it can be for anything as long as it's not relating to, it's not for buying something health. So, for example, you couldn't buy private physiotherapy with it. You couldn't buy a private GP because that's a service that's provided by health. But if it's anything else, yes, you can. So we've used it for all sorts of things like moving beds, getting a private removal firm in when someone needs a bed downstairs, getting them to move it. We've used it for dog walking. We've used it for taxis when people have been in step down beds in other areas. So the one-off PHBs, we process all those on behalf of our health and social care. Care assessments, obviously, direct payments. We provide direct payments for social care. We provide personal health budgets for health. And we have a Living Well Sefton contract, which is all around that, the health. So it works a lot with the social prescribers and health colleagues around the health remit for carers, and that's funded by Public Health. Next slide, please. Just as an example, these are just a couple of examples. So as a partnership, the virtual wards, one of the things that they didn't take into account was PAs through direct payments with social care. So if you've got someone who's on a virtual ward and they've got a direct payment with a PA that the person employs, and they're going on a virtual ward, it's 100% likely that PA will be involved in that care of that directed virtual ward. But a PA under direct payments from social care is not insured to do activities from a health perspective on a virtual ward. And that was something that was missed between our social care and our health partners. But as a voluntary sector who delivers direct payments, that was something we were aware of. And it was a difficult thing to get health to understand and a difficult thing to get social care to agree to. But we did broker a meeting with the insurance provider, and it was agreed that they would do endorsements on insurance policies to extend that cover for the virtual wards. So that was just an example of how partnership with voluntary sector health and social care can work. And then just a quick example of how that one-off PHB and hospital discharge works. So this was a gentleman who was 80. He was referred by a social worker from Southport Hospital after having a fall in his sheltered accommodation. There was a need for assistance in purchasing a microwave because his gas had been disconnected. So the patient couldn't go home, and he also needed some new bedding as well. So the gentleman's neighbour and unpaid carer agreed that we could make a payment to him in his name, and he would go and purchase the items. The social worker did the calculation of what it would cost. We provided that payment within 24 hours. For the unpaid carer to get that, and then we also provided the support from our hospital discharge team and did a carers assessment. So they're just two examples about how the importance is of bringing in partners like the voluntary sector and carer centre into both health and social care developments from the beginning and not too late into the journey when it's hard to change. And I think that's me and my 5 minutes up. Thank you.
Perfect, Vicky, and a couple of really nice real-world examples there. Thank you. Neil, are you happy to chat us through how we might end up seeing some more great practice like that over the next 10 years?
Yeah, thank you, Dom. And hello, everyone. My name's Neil Churchill. I'm the Director of People and Communities, NHS England, and I look after my mum, who's 90, nearly 91, frail, living on her own. Just start off just to pay tribute to the Carers Partnership and the Health and Wellbeing Alliance. It's really helpful having you to work with right across the range of things that NHS England does, and you can help us to make sure in all of the things that we do that we're thinking about carers and how we can support carers better. So I'm just going to say a little bit about how we see a more strategic approach to supporting and partnering unpaid carers is going to come about in the next few weeks and months through a new long-term plan for the NHS. I think just recognising where we've come from, it has been really clear that carers need to be front and central in the strategy. We saw that from the NHS Assembly report that they produced on the NHS 75th anniversary, and we saw that echoed in Aradaz's diagnostic about where is the NHS today, which called for an overhaul really about how the NHS works with carers. I think in terms of expectation, the strategy that will come out isn't going to cover everything because it is going to be quite a tight strategy looking at how the NHS will be different going forward. And I think it will be backed up by a range of other resources. But what we're looking at is three major shifts. So there's a shift for the NHS becoming more preventative, the shift to more care being provided at home or closer to home, and the shift to more being digital. You'll have heard those before, and the NHS has tried to deliver those before to mixed success, and we need to do better this time. But one thing we'll all be really clear about is that carers are central to each of those three shifts. So if we think about prevention, quite a bit of that is around secondary prevention, so helping people who've got a condition from stopping that deteriorating or from new conditions. combining with it. As unpaid carers, that's one of the things we're always looking out for, and helping the people we look after to manage and to try to stay well and healthy. Carers have a key part to play in that, as well as some of the more diagnostic tests that we might be able to put in place, and routine monitoring. Clearly, if we're going to be providing more care at home or closer to home, that's something that carers, I think, are often very supportive of, and will play a major part in. Is interested in talking to some unpaid carers about how they have found the experience of dealing with home technology and wearable technology and things that aren't about technology on smartphones, and found that it was very intuitive for people to use. But in that, we need to recognise and support carers in their caring role, but also make sure that we recognise the need to keep carers well themselves, and provide support for them, often when they are not putting themselves first and their needs are coming well down their pecking order. The NHS needs to do better than that. And then the third shift around more digital, we're looking at much more being able to be done through the NHS app, and other resources. This will be, I think, really helpful for me. To give an example, my mum often seems to have lots of tests. She then spends a long time ringing up a GP practice to find out the results of the tests. Or she has appointments, and we're trying to organise appointments so that I can help her to go in and come with her. It's not easy to do on the telephone, as you all know, being able to go onto the NHS app, and for me to be able to do that, or to find out her test results and pass them on to her, will be easier for both of us, or to change appointments online. So all of these things are coming. There's a lot that we wanted to hear from carers, and I think one of the really good things is the engagement that we've done on the 10-year plan so far has had a huge input from carers all around the country. So I believe that unpaid carers are one of the largest groups that has fed in so far into the engagement for the 10-year plan. So no doubt there are lots of excellent ideas that have come forward, both in terms of how the NHS needs to work, and some practical ideas about how we can bring it about. So yes, Dom, I think we will see more like this, but I just want to thank you for the work you've done today. The resources that are being made available are extremely useful, tried and tested, really practical, really good at supporting carers, supporting patients, and being really easy to use in the NHS, and make sure that we provide more efficient care too. So just really to underline the importance of the work that's been done, and thank you for it, and look forward to hearing more of the examples this afternoon.
Perfect, thank you, Neil. And we'll be hearing from the team and colleagues that have been behind a lot of those resources very shortly. But first, Emily, if you're happy to take us away on some of the bits around legal responsibilities.
Great, thank you so much, and what a fantastic introduction. So I know we've got a huge wealth of knowledge on this call today, and it's a reminder, Vicky mentioned it, as did Philippa, that we actually have some really important legal provisions in our toolbox, and they are largely permissive, as well as showing what needs to be done. So you can see, could we move on to the next slide? Thank you. So you can see in the purple box, this is what it means, but just sort of some quick focuses on all of the overview of the resources. Got details, a few of the resources. It covers carers of all ages. That's the first principle, from young carers right the way through to carers who are way over 100. There's the duties to cooperate between local authorities and health. Health have direct responsibilities towards carers. There's a responsibility and a duty to promote health inequalities. So if carers are experiencing health inequalities, that also is included. But also these very important sort of foundational duties as well to involve carers. So that strategically in the Health and Care Act, we would expect carers to be involved strategically. We'd expect ICBs and ICPs in integrated care partnerships to show how carers had been involved, and there are duties on the integrated care boards to promote the involvement of carers around prevention, diagnosis, treatment and care in relation to the patient. So the question for all of you is, how is that demonstrated? How does the ICB demonstrate that? And the other final point that I wanted to make that links very importantly to what Vicky was giving you examples of is hospital discharge, duties on NHS trusts to involve carers at the earliest point, and that reads across into virtual wards and where there are responsibilities on virtual wards. So you can't just absolve your responsibilities, and trusts we would also expect to demonstrate how they're doing that in policy terms, but also in practice. And we would also say that measuring carers' experiences of hospital discharge is so important. It tells you a lot about systems and process and practice, and that's where local carers organisations can also provide this fantastic input. The Care Act, of course, is a hugely important piece of legislation for us, and duties to promote wellbeing in Section 1, duties on local authorities to provide information and advice, and prevention to reduce, prevent or delay in Section 2. Duties to involve carers, of course, in Section 4, and carers assessments in Sections 9 and 10, and importantly transitions for young carers and disabled children and sort of parent carers moving through to the adult legislation. And then if we turn to things like the Children and Families Act, of course, we've got provisions in there which support parent carers and young carers. And I want to just draw everybody's attention. I think some people have been involved in the work on No Wrong Door, which has been led by Carers Trust and others. The principle being that young carers, there should be no wrong door for young carers, which is hugely important. The delivery of services through adult social care directly impacts on children within families. And finally, we also list the Carers Leave Act in this resource. This is where employees have up to 1 week of unpaid carers leave in a year, prorated if you're part-time. And the purpose of doing this is not to forget that we've got these rights in legislation for all of us who are caring, and they affect your own employees. The flexible working, the new regulations and the forthcoming rights in the Employment Rights Bill will also affect employees, but also that fits into how people juggle, manage these really what can be challenging points in your working career to try and juggle work of care. I'll just finish by saying that most of this legislation is permissive. Just as Vicky was talking about personal health budgets, you know, there are very few restrictions on what you can pay, what you can very few restrictions on these things, so use it all creatively. You're backed up by the NHS Constitution in terms of involving carers, and we're all here to make life better for carers. So let's use this legislation constructively and positively together across health, social care and the voluntary sector. Thank you.
Fantastic, Emily. Thank you. And yeah, really clear demonstration of the roles that we can all play in trying to make sure that that legislation is carried out to support carers, but also the colleagues that we work with that perhaps don't have carers top of mind at all times. So make sure that it gets carried through. Okay, next, I'd really like to introduce Chloe, John and Rachel to talk about the main resource that we're launching today, and also to give yourselves a bit of an introduction, please. These guys have put in a huge amount of work, both sort of on this piece, but more generally around the Alliance, and have really kind of carried things forward to make sure that the Carers Partnership has worked smoothly and successfully.
Thanks, Dom. I think I'm starting. So I'm Rachel Garton. I work in the People and Communities division in NHS England. And I think the first thing that I wanted to say is what a real pleasure it's been to work with Carers Trust, Carers UK and other partners on the development, to support the development of this resource. It's a really good example of partnership work and engagement, and I think a really good reminder of what we can achieve when we come together and we listen to each other and we value different experiences. So you can see from the slide that the resource has been co-designed with a number of different stakeholders. We've had the input of unpaid carers, health and social care, have supported the development of the resource, virtual ward leaders, local carers organisations, local authorities and colleagues at NHS England and DHSC. And the resource you can see is entitled Identifying and Supporting Carers to Improve Integrated System Working. The purpose of the resource, as I think has already been alluded to, is to support health and care systems in England to improve inclusion, support and involvement of unpaid carers. It brings together those statutory duties that Emily's just spoken about and best practice, that is resources that have been developed by the Carers Partnership between 2022 and 2025. So really to help health and care professionals reduce health inequalities that carers face, to better identify unpaid carers and to drive transformative change. And I think for me, the great thing about this resource is that whilst it is really comprehensive, it's very, very straightforward. And I think from my own perspective of when I've started new roles working in NHS organisations, I'm a clinician by background. And I think starting those new roles, there's a plethora of resources out there. And having something that actually brings everything together in a really straightforward way is invaluable. The fact that it can be used by unpaid carers as well. If you're a very busy clinician, you've got more than one portfolio area and you need a go-to resource, I think this is going to be absolutely fantastic for everyone. And if you've used it, if you've worked within the unpaid carers area for a long time, again, we know there's a plethora of information out there, and having that comprehensive resource that gives practical examples is really invaluable for busy professionals. I've used it already. I've found it really, really helpful in my role at NHS England. So thank you for that to the Carers Partnership for pulling this together. And I'm going to pass you over to John and Chloe, who are going to take us through the resource in a bit more detail.
That's brilliant. Thanks, Rachel. I think I have the pleasure of going first. So hi, everyone. I'm Chloe. I'm the Policy and External Affairs Officer for Carers Trust. And just before I go on to one of the first sections, I just wanted to say thank you to the co-production group that worked with us when we were developing this project. One of the things that they said to us at the very, very beginning was, we kind of want all of this information in, but keep it really short and simple. And so I think as we worked through, we were really mindful of making sure we had all of the necessary information in there, but also having links to some of the other projects and resources. And what you'll see, as I've seen on the slides around the contents, is actually just how many things we link to and refer to. The images are actually of the resource itself, of the slides. So you guys are getting a bit of a semi-demo as we go through, so do have a look at those as we go through. But if you wouldn't mind jumping to the next slide, I'll talk a little bit about care identification. One of the things that we often say is that identification is key to carers accessing support. And when we're talking about carers in health and care settings, that's never more important, but it has to go beyond that identification. And so what we've talked about in this resource is about how to identify carers, but also how to recognise them. Because when we start recognising carers in those health and care settings, they start being invited to be involved in decisions around hospital discharge, or their needs being considered when thinking about virtual wards, as the two examples that Emily mentioned earlier. So for us, it was really important to highlight actually how can health and care professionals identify carers and what to do once they're identified. And you'll see links to resources like the SNOMED codes and the carers passports there as well. And just to flag throughout the resource, you'll see the little boxes that say we've included a good practice example from some of the local care organisations. And so there is one in there from the Carer Support Bristol and South Gloucestershire. So I'll say thank you to those and the others that have helped us with these case studies throughout the resource. And I'll hand over to John to introduce himself and talk about the next one.
Thank you very much, Chloe. My name is John Perryman. I'm Policy and Public Affairs Manager at Carers UK, and have worked really closely with Chloe and colleagues at Carers Trust on the development of this resource over the past year. And I would also like to put on record my thanks to Rachel and Sean Harris at NHS England, who have been our project sponsors as part of the Health and Wellbeing Alliance and have provided us with fantastic support and guidance throughout. The second kind of section of the resource is around hospital discharge and unpaid carers, and a number of speakers already today have touched on the importance of hospital discharge and involving and supporting carers, and Emily alluded to the legislative responsibilities that are placed on on providers in relation to discharge through the Health and Care Act. Really, in this resource, we've highlighted a number of the resources that are available to support both carers, local carers organisations, and health and care professionals themselves. The first is a fantastic toolkit that was developed by NHS London called Carers and Hospital Discharge. It is a really comprehensive resource to improve the experiences of carers and the people they care for during that hospital discharge process. Carers UK have also produced a number of resources. One is a checklist for carers, and another is a comprehensive fact sheet to support carers and make sure that they are asking the right questions of professionals and ensure that they are involved and supported through that entire process. Again, as Chloe alluded to, we have a good practice example from Camden Carers, which we refer to. Chloe, back to you.
Thank you very much. So one of the things that we started with when developing this resource was why it's important to support carers, and you'll see that as one of the beginning sections. And within that, we highlighted that caring, does have a negative impact on the physical and mental health of many carers. And so what we wanted to do is include something in the resource that reflected support that can be sort of signposted to and guided to by health and care professionals for carers to maintain their well-being. Now, the social prescribing good practice and top tips, which you see on the right-hand side, is actually a resource that was developed through the Health and Wellbeing Alliance in a previous year, and we were sort of really keen to include references to the previous projects in the resource. So in there, we have got the good practice examples and the top tips for commissioners and providers as well. But we do think that actually these resources are useful for everybody to have some awareness of. The main thing for us is we understand that not everybody's going to come across all the different types of carer support and may not even know necessarily what people are being connected to, but just having these things in the back of your mind about what is possible, what is available when coming across carers that maybe have had their health and well-being impacted by caring in their mind would be sort of really, really useful. So yeah, there are just a couple of slides on social prescribing in there. Oh, this is me too. So another one that we have included is actually from a project that came out earlier this year, which is our carer contingency planning project. And again, with carer contingency, similar to social prescribing, what we really want to encourage is health and care professionals to have it in their mind. What I'm hoping is some of you may have already seen a carer contingency plan, or if not, have some awareness of one. And certainly for local authorities and local care organisations, you'll have certainly seen them or helped carers to write them as well. These plans are most effective when everybody is working to the same page and have an understanding of how they work and what's needed in order to bridge that gap in support where a carer may not be able to provide the same level or any care at a particular moment in time. By having that understanding, it means that that support can be implemented really quickly, and we minimise the impact of when that carer is unable to care, hopefully reducing the amount of time it takes for them to get back to a sustainable level of caring that they choose to do and are able to do going forward. And you're seeing there the example for the plan for the best emergency plan from Carers First, which I've included an image of on the left-hand side, the purple one there for you to see. Over to you, John.
Thank you very much, Chloe. The next section of the resource touches on virtual wards or hospital at home, which again has been referred to a number of times throughout the presentations today. Just quickly, virtual wards are allow patients to get hospital level care safely at home and in familiar surroundings. We embarked on this project in collaboration, this particular project on virtual wards in collaboration with NHS England a couple of years ago as the rollout of virtual wards increased. We think they have real potential to support carers and the people they care for, but we wanted there to be real recognition that asking people to care for people at home through a virtual ward could lead to carers who are already providing substantial levels of care with greater caring responsibilities than they had already. As a result, we produced, in partnership with NHS England, a number of resources to help carers, local carers organisations and professionals involved in the delivery of virtual wards to really think about the needs of carers and how to involve and engage with them through the entire process of someone being admitted onto a virtual ward. Those resources include a professionals checklist, which includes questions for professionals to think about and ask themselves when involving carers at the start and throughout the process. A carer pathway, an advocacy guide for carers to help them think about the questions that they should be asking when they are asked to care for someone through a virtual ward. A policy briefing, which allows everyone to understand in real detail what virtual wards are in relation to carers. And I think importantly for a lot of people who are on this call today, a carer information leaflet for local organisations to tailor and use in their own work, in their own area, to allow carers to understand how to engage with virtual wards or hospital at home in their own locality. As Emily touched on a couple of minutes ago, under the Health and Care Act, Section 25, each ICB has a duty to promote the involvement of patients and carers in any decisions which relate to the prevention or diagnosis of illness in the patients or their care or treatment. And in practice, we think that means that the contribution of carers need to be properly acknowledged and valued. Professionals should be proactive in communicating with carers, and training and information should be provided to staff involved in the delivery of virtual wards so they can better understand the needs of carers. And I think I've seen going into the chat questions about whether these resources are available. Yes, they absolutely are. And when we share the slides, each of these links will take you through to those individual resources themselves, but also we'll share the entire resource, which has all of the links to all of the resources that Chloe and myself are talking you through at the moment. The next project that we have included was a project we did around engagement of integrated care systems through by unpaid carers. The statutory bodies that comprise ICSs are integrated care partnerships and integrated care boards, and they have duties as set out in the Health and Care Act, which mean they have a legal responsibility to involve and promote carers' involvement. So again, we've produced some resources, including a policy explainer and a carer engagement guide to support carers and local systems to think about what some of those barriers are, but also the ways that they can effectively engage and ICSs can fulfil their statutory responsibilities. Chloe, back to you.
You'll be relieved to know this is the final one from me. But yeah, just to note a little bit on the carers break section that we have in there as well. When we spoke to carers sort of independently, and then we spoke to the carers in our co-production group, they all told us that actually carers breaks are one of the most effective ways for them to be able to look after their well-being. But what we found when we asked what that respite looked like, what breaks looked like, it was very much different for every area, and there were different ways that it was being delivered. So, for example, it might be respite care for the person that they were looking after, it might be a respite service specifically for carers, or it might be funding to be able to do the things that that they want to do for themselves. And so for us in this section, what we wanted to highlight is, one, that it can be varied, and two, the role that people play as professionals in helping carers to connect to that support. In the example that we've given there, which is the Wandsworth Care Centre, they actually work in partnership with a local care company who provide respite sort of hours in a chunk of hours for carers throughout any one year. So actually for this particular resource and including that in the broader resource, if that makes sense, was about highlighting the way in which health and care professionals can connect carers who may benefit from a respite service with local services like the local care organisations, with local care companies, and other services and schemes that are in the area. Local care organisations offer a whole range of peer support groups and activities and things like that. Again, different for every area, but they do a brilliant job of offering that sort of micro respite for carers as well. So just linking to that. And the other resources we've included in there are around the taking a break fact sheet and supporting carers to actually take a break as well, which is a whole different topic to unpack. I'm sure John will agree.
Absolutely, Chloe. And then very finally, the final section of the resource touches on carers assessments. Again, as Emily spoke about, carers have eligible carers have the right to have a carers needs assessment under the Care Act. The resource provides information about why carers assessments are important and what those legal duties are, but it also highlights some of those resources that the Carers Partnership have developed, but also other partners, which can help people to better understand the diversity that exists in the delivery of carers assessments, good practice, but also really getting under the skin of what the Care Act means. Sky Social Care Institute of Excellence produced a fantastic resource in 2024, which we've linked to. The NICE guideline that was published in 2020 is also really helpful, and Carers UK have advice for carers themselves on how to go through a carers assessment, the questions to ask, kind of a step-by-step guide to it. So yeah, we hope that those resources are really helpful, both for local organisations, but also health and care professionals. And as we've kind of tried to do throughout the resources, bring together some of that best practice with the information that we think is really important, top-line information that we think people really need to know. I think that brings us to the end of our presentation, but we quickly wanted to hand over to Ellie and Jim, who both experienced care managers at NHS England, just to briefly touch on a couple of additional resources which aren't included in this work that the Carers Partnership have done, that they are working on currently, which are going to be published later this year. So I'll hand over to Ellie and Jim.
Thank you, John. So hi, as John said, my name's Ellie Colbeck. I'm one of the Experience of Care managers in the National NHS England team, and I'm joined today with Jim Smith from the same team. So as John said, we are currently in the process of updating 2 key national publications that influence how services engage with carers and closely align to the resource that we've just seen. So namely, those are the Commissioning for Carers document, first published in 2014, and the GP Quality Markers, first published in 2019. So it's been really important to us that both of these publications are co-designed with key stakeholders, and over the last few months we've been working our way through engagement processes for input. We've hosted now around a dozen or so workshops with health and social care colleagues, VCSE colleagues at a local and national level, and of course unpaid carers themselves. As I'm sure you can imagine, we have had a wealth of feedback via those workshops, far more than I can summarise in a few minutes here, but we just wanted to share a flavour of that with you at a headline level. So in terms of the Commissioning for Carers principles, we've heard that organisations want this to be shorter, less repetitive, have a focus on statutory responsibilities and the must-dos as opposed to the nice-to-dos. They want this to be supported by best practice case studies and self-assessment tools that enable commissioners to hold services to account. They want these documents to really encourage partnership working, and that's both with unpaid carers themselves, but also partnership working across the system, and a document that responds to the new healthcare landscape. And I think most importantly for us, what we've heard in all of our workshops is that these documents need to have the carer's voice at their heart. Jim, do you want to run through feedback for the GP quality markers?
Yes, please. Hello, I'm Jim from NHS England, and as Ali said, these were first published in 2019 and we're looking for a refresh now. And the original document and the refresh has been in co-production with Carers Trust and Carers UK. Well, the quality markers aim to support GP practice to become more carer friendly, and that's via 6 quality markers, and that's with a really strong focus on identification and support. We've been taking similar stakeholder engagement with carers principles, but that's with a specific addition of primary care organisations. We've heard much the same, to simplify, shorten, to make more accessible, to use more case studies and best practice. And then we've had a few carer specific issues come through to make sure that we give a basic understanding of who carers are, why they need to be identified, to include the benefits of the use of the marks to the carer and the person they care for, and more about awareness and helping carers self-identify, and then to include a specific focus on young carers. So where we are in terms of next steps for both the principles and the quality markers, we're aiming to get a first draft with national stakeholders around about the end of March. We'll be going through a design process in April. The publication will be likely to be late spring, early summer, but that's all dependent on release of the 10-year plan, because of course we'd like to reference that in both documents. And then we'll be looking towards some sort of pilot phase for both areas towards the end of December, the end of 2025. So thank you very much.